Let me start out by giving an update report on the coronavirus because let me just say that it's still present. So I want to address that and remind people that we are still dealing with COVID-19 pandemic. It has not gone away. With so much happening, let me remind everyone that the coronavirus is still present. The virus has not disappeared simply because we are focused on what happened in Minneapolis or other things that may be occurring right now or what's taking place in the city of Houston or in the parts of the country. And as a reminder, today, the City of Houston's Health Department is reporting 337 new cases of COVID-19, bringing the Houston's total to 7,743. So that's 337. The new numbers reflect 2 days of reporting due to the Houston Health Department having Sunday off. So these are 2-day reports being given in one set of numbers. The total number of deaths increased by 2, and so now that number is 131. Of these 131 deaths, 30 are associated with nursing homes and 3 with the Harris County Jail. So 30 with nursing homes, 3 with the jails, a total number of 131. The 2 new deaths that we are reporting are a white female in her 80s with underlying health conditions and a black female in her 70s with underlying health conditions, and both passed away in early May. As a reminder, the Houston Health Department and agency partners are providing free COVID-19 test sites this week. Houstonians can visit houstonemergency.org to find current Houston test sites and information about stopping the spread of the virus. And please be reminded there are about 27 sites throughout the city of Houston. They are free, they're open to the public, and they are available to you whether you have symptoms or you have no symptoms at all. And with all of the enhanced activity that is taking place right here in the city of Houston, let me encourage you, if you've been around crowds, mass gatherings, especially mass gatherings where people may not have had on a mask, or you did not engage in social distancing, let me encourage you to take full advantage of one of those 27 free testing sites that are located throughout the city of Houston. As people return to work this week and participate in demonstrations in memory of George Floyd, it is more important than ever to wear your face coverings, maintain social distancing, and practice good hygiene. We do not want a surge of COVID-19 in our community because we dropped our guard and just failed to adhere to the health warnings. I'm a member of the U.S. Conference of Mayors, in fact, a trustee with the U.S. Conference of Mayors, and today I join with other mayors across the nation in declaring this a national day of mourning for those who have lost their lives to COVID-19. We encourage faith and community leaders and all Houstonians to pause, reflect, pray, mourn, and honor all those who have died and to comfort those family members who have been left behind. I will be on a conference call later this week with faith-based leaders to discuss ongoing efforts to keep our respective communities safe. At this point in time, let me yield to Dr. Persse.
Thank you, Mayor. Today I want to discuss something which we actually touched on earlier, but there's a trend that we've noticed across, we first started noticing it in Europe, but we now have some data from the United States. And that is of people who appear to be missing a little bit of the message when it comes to staying at home and being afraid of contracting the virus. And that is that some people appear to be afraid to go to the hospital when they need to be going. So we have a slide up, and what you see on the screen is a graph from an article that was recently published in the New England Journal of Medicine. And this comes from the Kaiser Permanente healthcare system of Northern California. And so there are many, many hospitals that contribute to this data. And what you see on that, the yellow line is the number of patients who are admitted to those hospitals who are having a heart attack from January through the mid-April for last year. The red line is the same diagnosis of people being admitted for heart attacks to the same hospitals for this year. And what you, in the blue line, is the number of cases that have COVID-19 in those communities. And what you can see is that from when the curve first started going up and they had their first death from COVID disease in Northern California is right about exactly when the number of people going to hospitals with their heart attacks dropped off. And what that graph, it's kind of hard to see with your eye, but that is a 48% decrease in the number of patients going to hospitals who are having heart attacks. Now, that doesn't mean that heart attacks stopped happening. Heart attacks continue to happen. And I think that sometimes movies and TV drama mislead the public. And so people can have heart attacks and survive them. They just wind up with heart damage, which causes them to then have congestive heart failure and other problems. Completely avoidable if you call early and get treated early. Yes, some people will die from a heart attack. Some people die from their first heart attack. But again, if you call and get treated, heart attacks can be minimized, they can be reversed, they can be treated. But if you stay at home, you're going to suffer the heart damage from the heart attack. This slide is a look at what we found within the Houston Fire Department. And in this slide is the blue line is the number of folks that were heart attack patients that the Houston Fire Department transported last year. The gray line is, again, this is January through April for this year. And again, you can see it goes from a peak in February of 39. And remember, February is a short month. So in the month of February, we had 37 heart attacks that we transported, and in April it dropped to 20. Again, nearly a 50% decrease. So the message that I want to get across to folks today is that hospitals are safe places. You're not going to contract the virus if you go to the hospitals, with a critical illness. The hospitals have ramped up everything. They're doing a great job of protecting their employees. They're doing a great job of protecting the patients in the hospital. Also, the emergency department volumes are way down, so there are not a lot of people in the waiting room with the emergency department. Our Houston Fire Department, our total EMS call volume is down quite a bit. I think Chief Pena is going to talk about that in a moment. And most of that, a lot of that is people who are going to emergency departments who didn't need to go to emergency departments in the first place, so like medication refills and so on and so forth. So the emergency departments are not crowded. The waiting rooms are not crowded. So if you think you're having a heart attack, and if you want, you can go to the American Heart Association's webpage for the signs and symptoms. But it's what we've been talking. I think most Americans should know the signs and symptoms of a heart attack by now. A pressure-like sensation in your chest, particularly if it occurs after a little bit of exertion. Sudden shortness of breath, sweating for no reason, being nauseated for no reason. These are all signs of a potential heart attack. If you are having those, especially if you have a history of high blood pressure or diabetes or any of the chronic illnesses that we've been talking about, then these are all risk factors that would contribute to it. Stroke, we have the acronym FAST. That's when you suddenly have some paralysis on one side of your face. You have arm weakness, some aberration in your speech. You're not speeching correctly. That's the FAS of FAST. And T is time to call 911. So F for a facial weakness, A for arm weakness, S for a speech problem suddenly, and T, it's time to call 911. So if you think you're having a heart attack or you think you're having a stroke and you're afraid of the virus and catching the virus at the hospital, you do not need to be afraid of that. Call 911. The whole system is set up to help you to reverse your heart attack and potentially reverse your stroke as well. Hospitals are safe to go to. Thank you, Mayor.
Chief Pena, you want to amplify that message as well?
Sure, absolutely. Thank you, Mayor. Good afternoon, everyone. It's certainly been a busy year, to say the least, for public safety. As Dr. Persse has mentioned, the fire department's transports have been down in these last 2 months. We remain fully operational. We're staffing every apparatus, every vehicle that we have in place. And if you need 911, we encourage you to call 911. We're going to take every precaution that we have available to us to ensure your safety, the safety of our firefighters, but your safety and your public health is critically important. Don't hesitate to call 911 if it's a true emergency, and you will get the response that you expect from the Houston Fire Department. We, in partnership with the Health Department, we're taking every precaution that we can, and we're following CDC's guidelines. And through the mayor's support and leadership, we're ensuring that the personal protective equipment is available for our firefighters as well as for our patients. So again, 911 is there for you to use in true emergencies. If you feel that you need to call 911 for a medical emergency, do not hesitate. Do not fear that you're going to contract something by calling 911 and being transported to the hospital. That is the key, is rapid assessment and rapid transport is going to save lives. Thank you.
Thank you, Chief Pena. And of course, I'm standing here with Councilmember Edward Pollard, so thank you for being here. This is the first day of June, which is also the first day of hurricane season, and there is a system brewing somewhere out there, and hopefully it will will not come in our direction. But Chief Buenik, you want to speak to it?
Yeah, Mayor, thank you for your leadership during this COVID crisis, and for also still sending the message to have people mask up to prevent, because the city's made some real good progress on what we're doing. The Office of Emergency Management talked about last month about the hurricane preparation tips. We had Hurricane Preparation Week, May 3rd through the 9th. And, you know, some of the major tips we're talking about: make a plan, build a kit, stay informed, know your neighbors. I also mentioned at one of the earlier news conferences about purchasing flood insurance if you don't already have it, strengthening your house, and then also developing an evacuation plan in the event that the storm's coming our way and that you need to get out. I'd also mentioned about the Hurricane Preparation Guide, and that's available at houstonoem.org. It's in 6 different languages. Has all the information that you need. It has checklists, provides you some detailed guidance on what to do with hurricanes. Then in the middle, it actually has the evacuation plan by zip codes, very valuable document. But this week, we've been tracking Tropical Depression Amanda, and this is produced by the National Weather Service. They've provided us some graphics, and at least 5 of the models show it that it will possibly come into the Gulf. So we're looking at, you know, maybe Friday, Saturday. We're going to be tracking it each and every day. As we get closer to the weekend, we'll have a better idea of where the storm's going to go. There's a dozen different models out there, and a little less than half of them show it going into the Gulf. Other ones do not show it. But Office of Emergency Management has been working real closely with our partners, the police, fire, public works, and the rest of the city departments, you know, as we always do, to come up with the plan. So I'm here to say that the city's well prepared to deal with this, along with all the other issues that are going on in town. Thank you.
Thank you. So please be weather aware, weather alert, and hopefully it will not come in our direction, but please be weather aware. And then let me just say that June 5th, Friday, this coming Friday, is the City of Houston salute to our high school seniors throughout the city of Houston. This is like their week, Friday night, 6:30. The City of Houston salute to our high school graduates. So students from Houston Independent School District, Spring Branch, Aldine, Spring, A-Leaf. We are saluting all of those seniors as well as others. But I specifically want to acknowledge and thank the superintendents from Aldine, HISD, Spring Branch, Spring, and A-Leaf. And that's this coming Friday at 6:30. So please tune in. The high school graduates themselves will be going to their respective campuses or a designated place of the school districts. They'll be in their cap and gown with their masks on, engaged in social distancing. And their parents, relatives, and others will be watching virtually. But the graduates will be returning in many cases to their schools or their school district, where they will get a chance to say hello and meet their principals and teachers and fellow classmates. So that is this coming Friday at 6:30. Let me just say, with respect to this weekend's events and hashtag George Floyd and Justice for George Floyd, we want to continue to lift up his family and many of his close friends. Want to continue to lift them up. I want to thank the people in the city of Houston. Want to thank the people in the city of Houston, our marchers, demonstrators, protesters, for behaving responsibly and peacefully, especially on a Saturday evening, Saturday evening. About 98% of the people participated in whatever events that were taking place peacefully. So I want to thank you for that. I want to thank people on yesterday and last night in the city of Houston. Quite frankly, about 100% participation. Very few exceptions. There may have been a couple of arrests, and not in the downtown area, but in the city that may have been connected to some sort. How can I put it? A protest of some kind, but only a couple in the city of Houston. So yesterday, last night, about 100% participation, and people were very peaceful, very responsible, and so I want to thank you. To our police officers, I want to thank them for exercising a great deal of restraint over the last several days, and for their high degree of professionalism. I want to thank them. I want to thank our firefighters, Chief Pena, for the support that they have given, for being out there as well on the front line, and how they have handled things. All of our municipal workers, I want to thank them. But I want to thank the people in the city of Houston, our community leaders, community activists, faith-based leaders, and then just the marchers, the demonstrators, the protesters. Let me thank you for not working to destroy or deface our city. Other than Friday evening, things have been quite peaceful. Tomorrow, I want to give a lot of credit to and acknowledge Trey the Truth and Buenik. Those two are the principal organizers of the event that will be taking place on tomorrow. Don't want to take anything away from them. Trey the Truth, Buenik. These are two individuals from this city who have helped this city out in many, many ways. They are the principal organizers for the event tomorrow. The city of Houston certainly will support the efforts to make sure that things are done in a very peaceful and orderly fashion. And so, myself and I'm sure other elected officials will be participating in the march from Discovery Green to City Hall in unity with members of the George Floyd family. There are some members that are already in Minneapolis. There are many others who are still here in Houston, and I've had an opportunity to talk with the family members almost every day. I talked with a number of them last night. They were all together on last night. Very uplifting conversation, and wanted to offer the support of the city to let them know that we are continuing to pray for them and talk with them again today. And so we're going to continue to lift up this family. The march is not a City of Houston event, but it is being organized by our local community activists, like I said, Trey the Truth and Buenik and others, and the city will be supportive of this event. I expect the march to be peaceful and respectful, with a focus on George Floyd and his family. And what the family has repeatedly said, and they've said again today, is that they want the protest, they want them, of course, to continue, but they want them to be very peaceful. And they want people to do it in honor and pay tribute to George Floyd, but they do want these protests to be very peaceful, and I want to echo that as well. People have the right to demonstrate, to march, to protest, but in Houston, and quite frankly all over, we do want them and ask you to be very responsible and to do it in a very peaceful fashion. Houston has helped to set an example for protests taking place across the nation. I want to thank the city of Houston in its entirety for that. Police have made some arrests, and there have been some incidents in our city, but things have not gotten out of hand, and participants have remained peaceful for the most part. So again, thank you. Thank the city so very, very much for what you have done, and for what I know you will continue to do in the city that we all deeply love. But we want to keep the focus on George Floyd and hashtag justice for George Floyd. That's where the focus needs to be, and that's where we need to keep the focus and not do anything that's going to take away from that particular focus. And then we want to honor the family's request, and that is we make meaningful and impactful change and engage in meaningful and impactful reforms, and to improve it, our system, the way we operate, but not do anything that would take away from his memory.